B. Healthcare providers may attribute genuine disease symptoms to age, resulting in inadequate care. C. A chronically increased afterload caused by arteriosclerotic blood vessels. C. An overproduction of collagen and decreased quantities of elastin. 7. A decreased number of pacemaker cells in the sinoatrial node would most likely contribute to a decline in cardiac output secondary to a heart block. B. Bradycardia. C. Tachycardia. D. Atrial fibrillation. B. Bradycardia. 8. Decreased elasticity of the lungs and calcification of the costochondral cartilage results in A. An increase in residual lung volume. B. A significant increase in vital capacity. C. A decrease in airway size and resistance. D. A decrease in the total amount of air in the lungs. A. An increase in residual lung volume. A decreased sensitivity to changes in arterial blood content. 10. An elderly person is at increased risk for aspiration, primarily from A. Atrophy of the epiglottis. B. A decreased ability to swallow. C. Slowing of the ciliary mechanisms. D. Decreased cough and gag reflexes. D. Decreased cough and gag reflexes. 11. Aging kidneys have a decreased glomerular filtration rate, which predisposes an older person to all of the following conditions, except A. Hyperkalemia. B. Hypernatremia. C. Profound dehydration. D. Acute volume overload. C. Profound dehydration. B. Age-related changes in hepatic enzyme systems. 13. The leading cause of death from infection in Americans older than 65 years of age is A. Nephritis. B. Pneumonia. C. Encephalitis. D. Meningitis. B. Pneumonia. A delayed gastric emptying increases the risk of aspiration. 15. Therapeutic doses of certain drugs may reach toxic levels in older people due to deterioration of the A. liver. B. spleen. C. gallbladder. D. intestinal tract. A. liver. 16. Aging brings a widespread decrease in bone mass, especially A. in postmenopausal women. B. in men over 50 years of age. C. if the person falls frequently. D. in the presence of hypertension. A. in postmenopausal women. 17. Which of the following central nervous system functions does not change as a person ages? A. Postural stability. B. Cognitive speed. C. Memory retrieval. D. Intelligence level. D. Intelligence level. 18. When assessing an older person, you should remember that it is common for him or her to A. slur his or her words. B. present with hemiparesis. C. respond slowly to questions. D. not understand your questions. C. respond slowly to questions. 19. Most age-related visual disturbances are the result of A. diabetic retinopathy. B. cataracts or glaucoma. C. macular degeneration. D. retinal artery occlusion. B. cataracts or glaucoma. . 20. D. Loss of high-frequency sounds and the inability to differentiate a particular sound from background noise. 21. Typical signs and symptoms of Meniere's disease include all of the following: except of vertigo, B. tinnitus, C. otorrhea, D. hearing loss, C. otorrhea. 22. Impaired proprioception predisposes an elderly person to A. falls, B. skin tears, C. depression, D. hearing loss. F. falls. 23. Physiologic age-related decreases in skin elasticity are the result of A. decreased collagen and elastin production, B. chronic use of corticosteroid medications, C. slower replenishment of epidermal cells, D. frequent fungal or viral skin infections. A. decreased collagen and elastin production. 24. Due to the process of aging, an elderly person commonly experiences A. increased thirst, B. moderate hyperglycemia, C. increased insulin secretion, D. high fever with a minor illness. B. moderate hyperglycemia. 25. Failure of the heart's primary pacemaker and the development of alternate pacemakers in the atria would most likely result in A. junctional rhythms, B. atrioventricular block, C. ventricular ectopy, D. atrial fibrillation. D. atrial fibrillation. 26. Which of the following conditions is the older patient at greatest risk for? A. chronic hypotension, B. rheumatoid arthritis, C. peripheral vascular disease, D. acute myocardial infarction, C. peripheral vascular disease. 27. Which of the following cardiac dysrhythmias is associated with the highest risk of stroke? A. V heart block, B. sinus tachycardia, C. junctional rhythm, D. atrial fibrillation. D. atrial fibrillation. 28. Which of the following conditions would most likely impair pulmonary function by limiting lung volume and maximal inspiratory pressure? A. asthma, B. kyphosis, C. spondylosis, D. osteoporosis. B. kyphosis. 2. Require a controlled decline in blood pressure that often cannot be achieved in the pre-hospital setting. 30. Which of the following is the most common respiratory infection that causes death in the elderly population? A. pneumocystis carinii, B. respiratory syncytial virus, C. pneumococcus bacteria, D. mycobacterium tuberculosis. C. pneumococcus bacteria. 31. The risk of a pulmonary embolus increases with age because of A. increased immobility, B. chronic use of aspirin, C. frequent lung infections, D. drug-induced bradycardia. A. increased immobility. 2. D. the presence of more than one chronic disease. 33. Which of the following disease processes would most likely present with signs and symptoms that mimic those seen with normal aging? A. type 2 diabetes, B. hypothyroidism, C. thyrotoxicosis, D. hyperglycemia. B. hypothyroidism. 34. The relatively high use of nonsteroidal anti-inflammatory drugs by older patients predisposes them to A. constipation, B. cholelithiasis, C. mesenteric ischemia, D. peptic ulcer disease. D. peptic ulcer disease. 35. Kyphosis is characterized by a cartilage degeneration, B. Vertebral disc compression, C. Hunchback appearance, D. Lateral curvature of the spine. C. Hunchback appearance. 36. Type 2 osteoporosis tends to progress more rapidly in postmenopausal women. B. The lower extremity bones. C. Males over 60 years of age. D. Patients with excess calcium. Postmenopausal women. An acute alteration in mentation that indicates an underlying condition. D. A progressive disease that produces irreversible brain failure. B. Age alone is thought to be the underlying cause of Alzheimer's disease. 40. Resting tremor of an extremity and bradykinesia are associated with vascular dementia. B. Focal motor seizures. C. Parkinson disease. D. Alzheimer's disease. C. Parkinson disease. C. Changes in drug metabolism due to diminished hepatic function. B. The prescribing of multiple drugs to treat multiple conditions. A person takes multiple doses of the same medication because of an inability to distinguish the flavors. 44. Signs and symptoms of anticholinergic medication toxicity include hypotension, palpitations, and respiratory distress. B. Urinary difficulty, constipation, and hypertension. C. Epistaxis, abdominal pain, and blood in the urine. D. Hypoglycemia, depression, and poor muscle movement. B. Urinary difficulty, constipation, and hypertension. 45. Hypotension and orthostatic vital sign changes would most likely occur in elderly people who take diuretics. B. Beta blockers. C. Antidepressants. D. ACE inhibitors. Diuretics. D. He would experience a higher blood alcohol concentration due to decreases in body mass and total body water. C. Is associated with a higher suicide rate than in any other age group. 48. Elderly blank are at highest risk for suicide, and most often use blank as their suicide method of choice. A women, pills. B. Men, firearms. C. Women, knives. D. Men, hanging. B. Men, firearms. 49. Heat gain or loss in response to environmental changes is delayed in elderly people for all of the following reasons: EXCEPT, A. Impaired circulation. B. Chronic hyperthyroidism. C. Atherosclerotic vessels. D. Decreased sweat production. B. Chronic hyperthyroidism. 50. Which of the following is not a predisposing risk factor for trauma in the elderly? A. Slower reflexes. B. Decreased body water. C. Equilibrium disorders. D. Overall decrease in agility. B. Decreased body water. 51. An elderly person is more likely to sustain serious injury following trauma due to a brittle, demineralized bone. B. Ineffective vasoconstriction. C. Chronic renal hypertrophy. D. Decreased respiratory function. A brittle, demineralized bone. 52. Which of the following is an extrinsic cause of falls in the elderly? A. Postural hypotension. B. Dizziness or syncope. C. A. Pathologic fracture. D. An uneven sidewalk. D. An uneven sidewalk. 53. After falls, blank is slash are the second leading cause of accidental death among elderly people. A. Thermal burns. B. Drug interactions. C. Submersion injury. D. Motor vehicle accidents. D. Motor vehicle accidents. 54. Elderly people are more susceptible to intracranial bleeding because of a marked increase in brain size. B. Depletion of cerebrospinal fluid. C. Enlargement of the subdural space. D. Constriction of the cerebral vessels. C. Enlargement of the subdural space. B. Narrowing of the spinal canal and pressure on the spinal cord. 56. Fall-related fractures in the elderly occur most often to the blank, usually in patients with underlying blank. A. Hip, osteoporosis. B. Humerus, arthritis. C. Elbow, osteoporosis. D. Pelvis, osteoarthritis. A. Hip, osteoporosis. 57. Which of the following risk factors is associated with the highest rate of mortality following a burn injury in an elderly person? A. Age over 55 years. B. Musculoskeletal injury. C. Pre-existing medical condition. D. Proportional increase in adipose tissue. C. Pre-existing medical condition. B. Fluid replacement. D. Tend not to complain, even when they have legitimate symptoms. 60. A key element of the G in the GEMS diamond includes A. Checking the physical condition of the patient's home. B. Recalling that elderly patients often present atypically. C. Assessing the elderly patient's activities of daily living. D. Attaining a complete medical history. B. Recalling that elderly patients often present atypically. A. Determining if activities of daily living are being provided by another person. 62. Components of the environmental assessment of an elderly patient include all of the following: EXCEPT, A. Assessing for the odor of urine or feces. B. Looking for rotted floors or faulty wiring. C. Ensuring that food is adequate and unspoiled. D. Inquiring about any delays in obtaining food. D. Inquiring about any delays in obtaining food. 63. The medical assessment of an elderly patient can be complex because he or she often makes up symptoms that do not exist. B. Caregivers typically prefer that you speak with them. C. He or she often has more than one medical condition. D. Most elderly patients are hearing or visually impaired. C. He or she often has more than one medical condition. C. Speaking to the family member first rather than the patient. B. Chronic problems may affect the acute problem. A. Assess for the presence of a nitroglycerin patch on the patient, and remove it if she is wearing one. D. Attain a 12-lead ECG tracing, assess his blood glucose level, establish vascular access, and set the rate to keep the vein open, and transport to the hospital. A. Pneumonia. B. Subcutaneous epinephrine. C. This patient, who is in shock, probably has a bleeding peptic ulcer secondary to ibuprofen use, and the lack of compensatory tachycardia is likely the result